Well, good evening. Let me welcome colleagues and friends to this panel session at the end of the first day of the conference, a panel session on measuring non-market output during the pandemic. This is very much a subject close to my heart. When I first moved to ONS in 2004, the first subject I worked in is measuring non-market output with the late Sir Tony Atkinson. So it's a really very important subject so far as I'm concerned. It's also important because the non-market sector is approximately twice as large as manufacturing in terms of overall GDP. And it's also, of course, very important at the moment because of the impact of COVID on that output, and for that matter, on the way that we compare output GDP and size of economies between economies, where slightly different methods are in place in some countries than others. We have a very distinguished panel. Philip Wales is the head of the public sector division at ONS, and therefore has the unenviable task of actually having to face up to measuring non-market output. Diane Coyle is the Bennett Professor of Public Policy and co-director of the Bennett Institute at the University of Cambridge. Is also the co-author of a paper which is being discussed at this conference on productivity in UK healthcare during and after COVID-19. So clearly very relevant to the discussion tonight. Paul Schreier is the chief statistician at the OECD, an old friend of mine, but more importantly, a world expert in measuring output, including non-market output, and is also, of course, a keynote speaker at this conference itself. And then finally, and certainly not least, Ed Conway, who probably needs no introduction. Ed is the economic editor at Sky News, and before that at the Daily Telegraph and the Sunday Telegraph. Is also the author of several books on key issues in economics and economic policy making. What I'm proposing to do is to ask each of the panelists to talk for maybe no more than 6-7 minutes. And then that should leave us the best part of half an hour for questions and comments at the end discussion. You can use your Q&A facility to ask questions or make comments, and we'll then use that material when we get through to the discussion section at the end. But let me first, if I may, turn to Philip Wales and ask for your comments, Phil, on this not unimportant and certainly not straightforward issue.
Thank you, Joe. I'm just going to share some slides. I wonder whether you could tell me whether you can see those.
Yep.
Great. Okay. Well, thanks very much indeed. It's great to be here, and it's great to be a part of this discussion and this panel. It's clearly been a very unusual year for public services and for non-market output in general. It is one of the more challenging areas that we have in the national accounts from a measurement point of view, and it's one where we've had to really move quite quickly to try and make sure that our measures responded to the events as they happened on the ground. We don't have the luxury of waiting a year or two to let the data settle down. We needed to take into account things as they happened, and I think that was particularly there was a particular impact in education. So that's really what I'm going to focus my remarks on here this evening. To begin with, kind of what everybody knows, I think obviously the pandemic had a profound impact on the delivery of public services, both here in the UK and internationally. Schools were largely closed in the UK from the end of March last year, closed to in-person attendances with a very short list of exceptions. In the wider public services, large parts of the health service were closed down to limit the spread of infection, with operations delayed and cancelled. And both education and healthcare went through a period of really quite dramatic innovation over quite a short period of time, actually, as they moved services online. Think about the GP consultations that now happen over the internet. Think about the online learning that was going on. Capacity in some parts of the health service, even though some parts of it were shrinking, other parts were growing rapidly. The Nightingale hospitals, for example, were one one dramatic and large-scale piece of evidence of that, while entirely new services simply sort of sprung up from scratch. The test and trace program, the vaccination program. So these are all significant innovations, changes in activity that are going on for the public services that we need to capture in GDP. Just to give you a feel for the size and impact of these things, government makes up quite a significant portion of GDP. If we look at the industries where government is predominant from GDPO, so we have education, which is almost 6% of all output. Health and social care is a further 7.5%. Government overall is getting on for a fifth of GDP, so it's an important area of measurement. It's not one that often moves very, very rapidly, but as I say, it certainly did over the last year. While much of the economy is kind of measured using a fairly standard set of approaches, we go to businesses and we ask them about their sales and their costs and their prices, and we use that to infer our estimates of value added. Actually, because there isn't a functioning market, because these are non-market services, we need a different approach for these kinds of activities that we take from our kind of international statistical manuals, the European system of accounts in particular. For the kinds of activities that we're talking about here tonight and that we're focused on, actually, the manuals encourage us to look not at financial measures so much, but to look at direct volumetric approaches to measurement, which in kind of more lay terms means that we're looking at specifically activity measures, looking at the numbers of hospital treatments that are conducted, the number of students in school as a proxy for the number of teacher hours delivered, and then to weight those measures together using their costs of provision from some base period. So the change in output from one period to the next depends on base period costs, and then the change in activity from one period to the next. So you can draw a very direct line between the way that we count the number of kids in school and GDP. So what does that mean for education, and how did we respond to the unfolding pandemic? Well, in ESA, in the manual that we follow, we're encouraged to sort of count school attendances, to look at the number of kids in school and how that changes over time, and to use that as a measure for education output. And in particular, this is a kind of pre-pandemic publication. It doesn't include a provision to count remote learners in any way, shape, or form. So how did we respond? What did we do? Well, firstly, we moved not quite overnight, but over the weekend, from having a single kind of annual number for attendance at schools in England and Wales, Scotland, and Northern Ireland, to having daily estimates of attendance. So we could track what attendance there was at schools as it unfolded. And in April last year, it was between 1% and 2% of all students. So it was really, really very, very low. But we also had to innovate our measurement framework. We were confronted by a kind of choice. On the one hand, we had all these children learning from home using remote instructions. What do we do about those? Do we say actually they're not in school and so they don't count towards education output? It's quite an extreme assumption, and one that lots of teachers would say, well, actually I'm providing remote learning. Why doesn't it count as output? And on the other hand, we could say, well, okay, they're just the same as a student in school, and we could say, okay, we'll count them as the same. And that doesn't feel quite right either. It's really, economic reality lies somewhere in the middle. There are services being provided to students, and we have to find a way of valuing those. And we went about that to try and innovate this measurement framework by building a relationship with a group called Teacher Tap, and they provided us with critical intelligence to help us come up with a scientific way of valuing remote learners so we could include them in our measures of education output. They survey teachers each week, so we're able to ask them lots of questions about what's been going on. How do we do this? Just very quickly, we did this looking at a couple of different components. So one thing the guidance is very clear on is that if you are teaching your child at home outside of the formal education system as a kind of home learner, then that counts as home instruction and counts as household production, not as education output for GDP purposes. So the first thing we did was to look at the extent to which teaching depended on parents and not teachers. And then the second thing we did was to look at how teacher input had varied using a variety of metrics over time, on the basis that if teachers are providing less input, then they're also providing less, generating less output. We use these two factors together to generate a kind of full-time equivalency factor for remote learners that led us to include them in our framework. The data that we collected for this, for these things, we can talk through and look at. We could ask between 5,000 and 6,000 teachers each month, as we've continued to do over the course of the pandemic, the extent to which parents were important in delivering teaching. So on the left-hand side here, you can see for primary schools back in April 2020, about 40% of teaching was dependent on parents, the remaining 60% on teachers. For secondary school students, it's a good bit lower, which accords with our intuition. You know, there are lots more independent learners in secondary schools than there are in primary schools. They can read, they can write, by and large, they can use a computer, and they can pursue their learning objectives from home. We can also look at the metrics we used for teacher input and how that varied over time. These compare, for example, the amount of input that a remote learner is getting to the amount of input that someone in the classroom would receive. And here you can see how that's changed over the course of the pandemic, and that it's a bit higher for secondary school students than it is for primary school ones. If we take these two together, they give us the full-time equivalency assumption that we've used in the national accounts to count remote learners. So you can see that it's a bit lower for primary school students. Back in April 2020, a remote learning primary school student counted for about 0.3 of a full-time equivalent. If for secondary schools, it's about 0.55. And both of these have gone upwards over time, indicating that teachers think that actually remote learning's become a better approximation for the in-classroom experience. These data have let us include and innovate our measurement framework, so they've been included in our GDP estimates and helped us to explain the fall in GDP in the second quarter and over the course of 2020 as a whole. You can see here that between the peak and the trough, GDP fell about 21.8%, of which 1.5 percentage points was accounted for by education. Today, actually, education output's still below its pre-pandemic peak on the data to Q4 and accounts for 0.4 of the 7 percentage point fall in GDP over that period. We are going to be using these data and doing a bit more just to provide a little kind of information for future work. We'll be looking at our teacher tap adjustments to show how these things vary by different types of school, because the data let us do that. So we can look at the extent to which remote learning has been a good substitute for the in-classroom experience by Ofsted rating of the school, for example, or indeed by region, and we see some variation here too. So there's a lot more interesting analysis that we hope to follow the work that we've done here. If you're interested, there are 2 more articles that we have published, but I think this is a really challenging area of measurement where we've had to move quite quickly and where we've been able to include, as they've developed, the circumstances they find as we find them on the ground in the statistics that we publish. I think that's it for me, Joe. Thank you.
Thank you very much, Philip. That sets out the issues very nicely. What I'll do, if I may, is to move straight on and turn to Diane. Diane Coyle.
Thanks very much, Joe. Hello, everybody. So the title of the session refers to measuring non-market output during COVID-19, but it's quite a challenge even without the pandemic, as Philip was indicating. My starting point in thinking about the health output, which I'll be presenting in another session at the conference, was the observation of a steep decline in the second quarter in the published figures, which didn't really match people's observation of how busy hospitals and hospitals were, and I know intuition about what was going on, because if they were busier than ever, how could it possibly be the case that output had fallen like that? And also when you compared what happened in the UK to some comparable countries, the output decline that we had seemed that much larger. So even at the best of times, and Paul is a much bigger expert on this than I am, it's quite hard to compare across countries because there are different structures, different mix of private and public, and the same methods get applied in somewhat different ways. So you can get quite a lot of difference anyway. But the real challenge is that, as the formula in Philip's slide shows, this is basically an index number problem. You've got a lot of different activities going on in healthcare, critical care. It was on our televisions every night. We saw the strain it was under, the surge capacity that hospitals installed and delivered. And yet at the same time, lots of other activities in the health service were in decline. Voluntary visits to the GP declined, elective surgeries vanished to nothing in that second quarter. Even A&E, and actually even pediatric A&E admissions declined quite sharply. And so the issue really boils down to what weight do you want to put on the increase on the one hand and the declines on the other hand. And if you're using normal times weights, then the declines carry a much bigger weight in the final output number, final output index, than the increases do. And that was the challenge. And actually, like so many index number problems, it seems to me there's not an obviously right answer to this. And it almost depends what perspective you want to take on what has happened. Because of course, the staff in the hospitals were working unbelievably hard. And at the same time, a lot of health treatments that would have been provided otherwise were not happening. And there'll be, as we've been hearing in the news, an immense backlog in the NHS from dealing with that. So that is just a kind of fundamental challenge. And I think, ONS is surely thinking quite hard about how they treat the index and the weights going over time. There were a number of other things that struck me during the work that we did, which was a combination of trying to understand from the top down what had happened to the numbers, but also some bottom-up qualitative research in two big hospital trusts in Cambridge and in Manchester. And one of the issues that cropped up that I think is relevant here is how to think about technology. If you're thinking about productivity enhancement, then technology is clearly one of the drivers of that, and installing and implementing. And a lot of the attention has focused on patient-facing technologies and video consultations. And the change that NHSX had hoped for over a period of years happened within the space of months. So it can clearly be done. There are two issues about that, I think. One is the distributional one, because a lot of it depends on patients having access to certain technologies, be it a smartphone or a pulse oximeter or whatever, and knowing how to use them. So there's a clear distributional issue there. And then secondly, what are the patient outcomes that are going to be? And I don't think that evaluation has begun yet, and that will take some time anyway. But that's what all the hype is about. Actually, there are other aspects of technology to think about. One is about the standard one of NHS innovation in technology and in treatment. And the other that I think emerged from the work that we did was thinking about technology as part of the organization of the health service. There was an instant switch to internal communication of using new technologies, on Zoom and Teams, as we all are. But also it really highlighted questions about patient information flow and data access. So the role of using data better to deliver better outcomes for patients. That takes me on to my next point, which is about the distinction between output and outcomes. And it gets quite blurred when you're thinking about health and education services, I think. So just within education, we're not going to know for a while what the impact on pupils' learning is over the long term. We're not going to understand the impact of the pandemic on health outcomes in the round for quite a long time. And there are some real challenges in understanding how those outcomes change over time and what is driving those outcomes. And if you think of something like asthma, the treatment amount, the volume of treatment has increased quite dramatically over the years. The treatment is very effective, but at the same time, that's clearly an environmental trend that's driving that increase in both demand and supply to respond to the demand. And if you look at COVID in particular, this is a socioeconomic disease. I've just started a piece of work with some colleagues, including epidemiologists, and it's just quite striking that when you control for socioeconomic factors, the incremental explanatory value of biomedical factors is low. So understanding the relationship between all of those environmental factors that affect people's health and what's the contribution of the health service itself is key, both in the short term around the pandemic and more broadly. And again, this is an old issue in thinking about what's the productivity of non-market services. And then finally, the other thing that struck me was thinking about the health service as a piece of infrastructure. We know that the NHS has been close to full capacity. It's been a market-oriented system with a just-in-time kind of approach to organisation. And this is a contrast to some other countries, such as Germany, which in fact had been criticised for the opposite. Before the pandemic, there were criticisms of excess capacity and inefficiency in the German health system. But that meant that as they went into the pandemic, they did not have the decline or such sharp declines in other kinds of health activity that we did. And you can think of that as being like peak loading for infrastructure. And it isn't at all obvious to me that having that capacity is inefficient in any way. And but it equally isn't clear to me how we think about that in terms of output measurement and productivity measurement. But understanding the role of the public services as social infrastructure that underpins productivity in the rest of the economy and growth in the rest of the economy seems to me one of the questions that we might pick up. And so I think my final comment, Joe, would be, Atkinson was a landmark report, but it was a while ago now, 2005. And maybe it's time for some more work thinking about these broader issues when it comes to productivity measurement and output measurement in the non-market sectors. And I think the pandemic has given us the opportunity to think about these issues and maybe return to them. Thank you.
Thank you very much, Diane. I couldn't agree more with your last point there. It seems to me it surely is the time to think about this more. I'm also struck, by the way, by the bottom line of a piece of OECD research some years ago, which suggested the health service around OECD countries was responsible for about 20% of health outcomes, and the other 80% was the socio-economic factors you mentioned. But talking of the OECD, the pandemic has not been just a UK phenomenon, and assuredly the measurement issue has not been just a UK phenomenon. So maybe I could ask Paul Schreier of his observations on these issues.
Thank you, Joe, and thank you for having me here to be able to say a few words about this important issue of non-market output. I will make a few general remarks really about the issues of measuring this. Let me start out by saying that we all know that for non-market producers, we equate the nominal output with the nominal input because we add up costs to get to our measures of output. The crucial question is then, how do we get to a volume measure of output? And looking around, there are three methods of doing so. One still widely observed is simply equalizing the measure of volume measure of output with the volume measure of input. So we just assume that those is the same. This is something that is done almost for all the collective services, so the general services like defense or general administration in most OECD countries. But it also still applies to quite a few measures of what is called individual services like health and education in OECD countries. So there is already some discrepancy in general in these measures. The second way of getting to a volume view of output is what we have in the UK, what Philip just explained, is to have sort of a cost-weighted index of the quantities of activities that are out there, either in health or in education or in some other areas. So this is a true output-based measures. And the third one, which in a way resembles the second one, at least in normal times, is that rather than having a direct measure of the quantities of output, one has a measure of a price index or unit cost index of that output that one uses to deflate the values that we get. Now, the distinction, especially between input and output, matters in normal times, but it matters even more so in pandemic, in times of a pandemic such as now. Diane already alluded to an index number issue that we have, and which I think plays out more strongly than usual in the current circumstances. If we use a quantity index like we do in the UK, fact, and we have some activities that go up very strongly, in particular in health, like intensive care treatment for COVID, and others that contract rather quickly. And yet the weights that we apply to those relate back to the year before the pandemic. Then we do have a bit of an issue with weighting what is happening, and there could be a possible downward bias to the index because of the weight structure that we observe. Now, if I look at other countries who use the opposite way of getting at the volume index by deflating, such as Germany, you would have exactly the opposite effect and probably observe an upward bias there, because the weights are those of the current period that would give too much weight to those activities that go up and too little to those that go down. The whole thing is more complex because we've been looking at quarterly data there, so the weights typically relate to annual to the year before. And all this needs to be worked out in greater detail and with some simulations to better understand the orders of magnitude that we're looking at. Now, as I said before, quite a few countries rely on an input-based approach for also health and education measures. There we really don't know which way the bias could go for a number of reasons. One is, well, even in normal times, we know that the volume of output typically does not move in the same at the same speed as volumes of input. But under the pandemic, we have an additional issue, namely when you have a setting where the government continues to pay a wage, but there is no labor input. Okay, think of a municipal stadium or a sports outfit where wages are being paid, but there's zero labor input or very little labor input. And yet the input measure is based on hours paid, for example. Then, of course, you get even the input volumes wrong, and therefore the output volumes wrong as well. But so therefore, there we come down to very important and almost subtle distinction between hours worked and hours paid that we apply to measure the inputs. And I don't know, what exactly is used where to make a clear statement here where we end up in terms of getting this right. So my conclusion is here, how to go forward is do everything, to get the quantities right, be it on the output side or on the input side. I mean, getting this basically right, the number of activities wherever we count them, but also to think about the weights a bit more. And I think trying to quantity update the weights, for example, to a more recent quarter is something that could help to get closer to reduce any possible bias that is involved here. Of course, then there are all these issues about explicit quality adjustment, like some of the things that Philip alluded to in terms of is the quality of teaching, remote teaching the same as presential teaching. That is important, but very tricky, of course, and complicated to pursue, yet worth looking at. So my main conclusion is a slightly sobering one in the sense that many things that we considered fit for purpose in normal times are much less so in unusual moments. But of course, the good thing is that it really makes us think again about this important part of our economies. And as was suggested by others, it's maybe a good moment in time to revisit some of the things that we've been doing in this space and that we want to do in the future.
Thank you very much, Paul. As you say, the pandemic's really given us a stress test in this area. And I completely agree. It supports Diane's conclusion that now is the time really to do a bit of rethinking in this area, and your conclusion too. This is an important issue from the point of view of public policy, from the point of view of the economy generally, but also from the point of view of health and the recovery from the pandemic as well. So Ed, if I could turn to you, for your feelings about this and the impact on public policy, how it's perceived.
Yeah, thanks, Joe, and hello, everyone, and thank you for having me on here. I feel very intimidated in the company that I'm on this with this panel, but I will just try and give you a kind of a sense of things from the media perspective, as it were, and the past year or so has been that I can recall. There's been greater focus on cross-country comparisons statistically across COVID than any other period I can remember. And obviously we've all seen the cross-country comparisons when it comes to COVID itself, to cases, to deaths, and there are statistical question marks over that. And inevitably there were going to be big cross-country comparisons when it came to GDP, and there still are. And I suppose that's the first starting point. And the second starting point is that I don't know if there was especially wide awareness. In fact, I'm pretty sure there wasn't especially wide awareness that the UK was calculating public sector output a bit differently from many other countries in the OECD, or indeed the rest of the world. I actually, as it happens, I was personally aware of this stuff, but it was kind of somewhat by accident, because when I was a relatively young journalist starting off, my first ever interview was with Tony Atkinson at the start of his investigation into this. I had an editor. I was a different newspaper at the time. My editor was very concerned with the amount that we were spending on public sector output. It was that kind of a thing, and wanted to find out whether it was all just translating into a complete lack of productivity. And so he sent me to see Tony Atkinson. I was in my early 20s, and I was completely charmed. He's wonderful, as I'm sure everyone who's met him will recall, such a wonderful man. And actually it turned into a far more interesting, chewy discussion about the nature of what is output and the nature of what is public sector output. But as a result, I knew that we had been doing something on this, but I confess I'd been slightly, and I suspect probably a lot of other economics journalists were slightly unaware of where we were, and more importantly, where we were versus other countries in the EU. So when we saw the big declines in GDP that we obviously saw last year, and saw the comparisons with other countries around the EU and around the OECD, I don't think the first thing that people jumped to was an assumption that there was something, with the methodology of public sector output that was going on beneath the surface. And I suppose that's one of the things that I would say is that, there was a big rush for this. The numbers were seized upon by the media. Given that what was happening with the numbers on deaths, I think there was a focus on whether the UK had also had the worst of it economically. And as a result, the figures on GDP, the headline figures, became enormously prominent in the public debate. And then it was only quite a bit later, I don't know precisely when, but maybe a couple of quarters later, that we started to see some stories about, well, actually, let's look at this. There was stuff in the FT, there was stuff elsewhere on blogs, and then I wrote something as well, saying, well, hang on, is this to what extent is this down to public sector output and the calculation of that? And there's elements of this that are unsettling, and one of them is that we weren't especially aware of this, and that this seems like it is somewhat consequential for the cross-country comparisons, or if less consequential than I think some people had assumed at first. The UK clearly has still had an enormous fall in output. It maybe is not quite as bad a fall, and maybe not quite as big a bounce back afterwards if we're looking like for like. But I suppose that brings me to kind of the overall point. It would be nice in general, as a lesson from this, to be able to say what our like for like performance is compared with other countries around the world. And I'm still not sure if we're any closer to that. I would like to be able to see UK, and if there are other countries just basing everything on output equals input, then can we just see the UK like for like output versus input GDP figure as well, and just see where we would compare on a like for like basis? In a sense, there's an analogy to what we've seen with COVID itself. The point I started with, it's no one knows for sure just how comparable these numbers on cases and deaths are, and we all even though most of us deal in the world of economics, we've all probably looked at these numbers and wondered those same questions about what the underlying ability to compare them is. I didn't think that was going to be a problem with GDP, because I kind of assumed that you know, we were dealing with numbers that we kind of knew how to compare. So the fact that there are question marks, I suppose, is an opportunity to do some of the things that, for instance, Diane and Joe and Paul were talking about, and actually let's start to take a look at these things and think about how they are calculated. I don't know, for instance, and sorry, most of this is me kind of raising questions rather than answers, you know, but I don't know, for instance, and Paul may have an answer to this, the extent to which the UK is kind of gold standard when it comes to calculating our public sector output. But I'd like to know, and I'd like to know the extent to which other countries, you know, are as well. And I would like to know I'd like to have more kind of transparency on how the data is collected. And I think the ONS has done a fantastic job through much of this pandemic in various, you know, social statistics, but also lots of the economic statistics. And clearly, Philip and his team and his colleagues have worked very hard to try to adjust this stuff on the hoof. And in a way, I'm actually, although there's a bit of me that looks at it and sees, you know, there are kind of brand new online surveys which are suddenly contributing towards GDP. It half unsettles me, because I'm wondering about GDP, and it's the gold standard of economic measurement, and you know, we've got a brand new survey in the middle of it. But by the same token, clearly it's an unprecedented period, and you know, we need to, and you need to find the best way of illustrating what's actually going on in the economy. So I'm cheered, while also kind of, you know, wondering I'm sure that safeguards are taken to ensure that these numbers are reliable. But the more transparency we could have, the better. And more generally, you know, I would like to know, just with in future years with regular GDP numbers, the extent to which they are being boosted or otherwise by certain activities in the public sector. You know, during this crisis, we learned that, for instance, track and trace was contributing quite a lot to the rebound in GDP, because that was one of those elements of public sector healthcare activity. But as I recall, that's pretty much, I think, the first time, or one of the first times I can recall seeing a kind of performance-based or output-based measurement when it comes to health or the public sector being in there. So it would be nice if all that stuff could be a bit more prominent in future, and then the ONS could continue to be transparent about the extent to which these considerations are forming part of GDP. But yeah, no, I think the pandemic has been kind of interesting in shedding light on this. And as I thought Diane's paper is really interesting to the extent that, you know, we with statistics, we look at them and we hope that they're going to provide us with a kind of a corrective. If our innate assumption is, look, the healthcare system has been working overtime, therefore it must have higher output. It's quite useful to have a statistical basis for trying to glean whether that is actually right, or whether, when you adjust for everything, outpatient appointments and other activity within the healthcare sector actually compensates for that or not. And so there are kind of interesting questions that are raised by all of this, and I hope that, you know, we can do more to talk about that in the future. I think there is more interest now in the media in trying to understand comparability, and I'd like to, you know, I would like in future to understand the extent to which our GDP numbers genuinely are comparable with other countries, and not just when it comes to public sector output, also, you know, things, some sort of health check as to whether things like double deflation or other aspects mean that our GDP numbers aren't necessarily quite as comparable as you might have thought with other countries around the OECD or indeed the EU. So I'm very interested to see more stuff from the OECD on that as well.
Thank you very much, Ed. I also wonder quite a lot about comparability and the extent to which we have it or not. I'd like to bring in some questions from the audience. Maybe I could just first very briefly ask Paul Schreier what his feeling is about, do we have GDP which is comparable around the world, or actually is a misunderstanding about how comparable it is?
Well, it always depends on how you define comparability. I mean, there's clearly no perfect comparability. On the other hand, we do have pretty well established standards, and there's a lot of discussion, of course, in the statistical community about how to maximize comparability. Now, in the non-market sector is probably an area where things are least comparable, but even there, it all depends on the situation. You see, I mean, we're just talking about this issue of health output, and I don't think in normal times it makes a huge deal of difference whether Germany uses a unit cost index to deflate its diagnostically related groups, or the UK uses a direct quantity index to do the same thing. And yet, in a year like 2020, it may make a big difference for the quarterly figures. I mean, we have similar issues, say, on unemployment, okay, where this whole question of international comparability of unemployment rates came up because of a differential treatment of furloughed workers in, say, in the US versus Europe. I mean, in normal years, this is something that happens, you know, at the third digit behind the unemployment rate and suddenly explodes. So it is hard to foresee these things actually when we talk about comparability in normal times. So everything has to be relativized. In other words, we really have to draw the lessons from the current situation to see where we can improve things. I should add also that we initiated a project with the ONS only a few weeks ago, where we want to dig deeper into this comparability of GDP, in particular non-market output measures between the OECD countries that we've been observing and some of the issues we've been talking about for 2020. So hopefully with a view to getting a better handle on the orders of magnitude that we are talking about in terms of what is happening economically speaking, and what is happening statistically speaking, because it's not always easy to disentangle those things.
Thank you very much. That sounds a fascinating piece of work, actually. I'm sure quite a lot of us will be interested in the outcome of that work when it's available. Now, can I turn to Mike Haynes, who has a question about education?
Mike Haynes, microphone doesn't work.
Oh, okay. Okay, in that case, well, that's sorted out. Martin Wheel, I think, has got a question.
Yeah, I think that was directed at my statement about the index. Again, I think this needs to be worked out in greater detail because we're talking about quarterly changes with annual weights. But
should we just let Martin have the opportunity to ask the question so everyone's aware of it?
Yes, I mean, my question was that I don't understand why there's a big difference between the unit value and the volume change measures, because no, if we want to calculate a Laspers index for the volume change in NHS output, then we want to value this year's activities at last year's prices. Now, obviously, we don't have a 2019 price for test and trace, but it's not too difficult to imagine what it would have been because we know how labour costs have changed. So why can't one deal with the new activities simply by giving them an assumed value at previous year's prices?
Okay, Paul or anyone else who would like to tackle that?
Well, I think it's a matter of updating the weights from the annual average to a quarter that is a bit closer to what we're observing now. Probably the unit values or the unit costs for a particular treatment won't have changed that much, but of course the quantities kick in differently. So you would get a different set of weights if you bring them a bit closer to the latest quarter, and that would attenuate some of the shifts in the quantity index.
Okay.
Thank you.
Yep, Joe, maybe I could come in there as well, Joe. So I think we
Please,
are.
yep.
So I think this is quite an interesting kind of discussion, and I think the specifics of this really need to be thought about quite carefully. So Martin, the approach that you outline is something that we're thinking about quite actively. It's the case that those first estimates of GDP that we've published, we've included kind of indicative estimates, our kind of early view on the impact of things like test and trace on GDP, with a view to improving our methods following some peer review further on down the line, so that we can bring things like test and trace into the suite of things that we do through these direct volume measures. And it's exactly the scheme that you outlined that we've been thinking about. So using estimates of, if you like, the unit costs of test and trace as they would have been had this service existed in earlier years, to help us to do that. So I think this is a discussion we should continue. I think there's a quite interesting debate to be had about what we do with weights over this period. The pattern of, in particular, things like the expenditure weights that are used in the national accounts for 2020 especially, is going to be very different to the preceding years, and one hopes the following years. So there's some quite interesting methodological questions about how we use those weights down the line.
Thank you.
Thank you very much. Mike Haynes has suggested I should read his question, given the microphone difficulties. And the question from Mike is this: what's the logic of treating higher education output in a different way to schools and assuming no decline in output? Is not the logical similarity simply being obscured? Not sure who's best placed to answer that, but let me lob that question in.
So maybe as I talked a little bit about education, Joe, let me have a go. So I haven't come prepared to talk specifically about universities. I think it's right to say, Mike, that lots of the same issues obviously affect education in universities as would in the wider education service. I think in terms of secondary and primary school students, obviously they're working from home, so are students in university. So I don't think we would deny that there hasn't been some sort of impact of the pandemic on universities. I think if I go back, I will double check this, but my understanding is that we use a different approach to measuring the output of education in universities to that in schools. So we don't have a direct volumetric measurement, in part reflecting the treatment of universities in the national accounts. So I will double check that, but that's my understanding, and whether or not that's appropriate, something that we can certainly think about. For what it's worth, I think the evidence that I talked about suggests that, well, there will have been an impact, that we'd expect it to be somewhat less than, for example, in primary schools. So in primary schools, clearly there's been a big change in the way that education is being delivered. There's learning from home and parental involvement. But we can already see in secondary schools that where you have independent learners, where you've got people who are able to read, write, and use a computer, there's a lot less of an impact, because they're able to follow that instruction online, and I'd expect that to continue to be the case to some degree for higher education. So yes, there's certainly an impact, but it perhaps might be as big as we've observed elsewhere in the system. I think that partly reflects the way that we measure it in the accounts at the moment. That's something we can think about in the future.
Can I just add, if you think about the reality, not just how it's measured, as well as the independent learners point that Phil has raised, the part of the technological innovation in universities hasn't just been lecturing on Zoom, and actually lots of students already used recorded lectures. It's also been things like making resources available online, whereas before you had to go to the library. So I think there are some more complicated things going on.
Okay, thank you for that. Josh Martin has a question, which I think goes very much into some of the issues you've been making, Diane, and also some of Ed's issues. Josh, do you want to put your point?
Thanks, Joe. So I head up the productivity teams at the ONS, and for many years we've published statistics on public service productivity, including quite a lot of detail about the methods and the data sources that Ed said he couldn't find, and also making quality adjustments for about half of public sector output, education and healthcare primarily, where that's easier to do. So it feels to me that some of this information and some of this work is out there. I'm just wondering if anyone would like to make any suggestions on what we can do to raise awareness and help people find that information and maybe make better use of it.
Ed, any thoughts?
Yeah, I mean, in a sense, I mean, it might well be that this pandemic and the experience that we've gone through with numbers over the past year might well prove a, you know, kind of an opportunity to grasp this nettle. I think I'm trying to remember what happened after the Atkinson review, but you know, I think as Diane slightly alluded to, you know, there was a lot of focus on it back then, and it was partly, you know, it's partly born out of the fact that a lot of money was being spent on the public sector. So there was, I think, a lot of consciousness that we need to think about how we best measure output. But things just kind of went a bit quieter, and I don't know if that's just the absence of a government review or that a lot of this stuff was ongoing, but without there being all that much noise about it. And I mean, whether that's as it should be, I don't know. But some, you know, it would be nice. It would be useful to have some sort of a kind of, you know, a landmark review or some sort of paper from the ONS that would actually, or indeed from the OECD, that would give us as journalists an opportunity to say, well, here's where we are. There have been all of these changes, that some of which have been kind of like quiet, some of which is the kind of quiet implementation of Atkinson, which I know has taken place gradually over a period of some years, for us to be able to say, well, here's where we are, and here's how much of GDP is contributed to by these measures, and here's what's not, and here's what might happen in the future. But I mean, there's no straightforward answer on what can interest people or what might not at any other given time. But what I do know is actually there is this, perhaps surprising to news editors, but also sometimes to statisticians, there's a surprising appetite amongst many of the general public to understand more about how these numbers get put together. One of the pieces that I made at Sky kind of relatively early on that had, to the great shock of my editors, one of the biggest impacts that we've done was something simply just explaining how GDP is put together, you know, from survey, you know, from sales in the shop to surveys to the ONS where it is actually compiled. I was told that no one was going to be interested in it at all. As it turns out, there was a lot. So, you know, I think amongst us journalists, perhaps we could put a bit more effort into, you know, a few more compelling reads about these numbers. But in order to do that, it's quite helpful to have moments like this to show that the tweak, what might look like a tweak in public service output, turns out to have an enormous impact when it comes to the big figures and can make headline news. So perhaps one of the upshots of this is that in the next year or so, as if there is more research released on this, we can talk to an audience which is already engaged with why this matters.
I know that.
Any thoughts from you as next journalist?
I know a good book about GDP, if anybody is interested in knowing how it's put together. I do think there's an opportunity. There is, as Ed says, great interest in understanding how what's going on is being measured. And I think also quite a wide sense that what's being measured doesn't always tally with people's experiences, which is where I came in. You know, the people are experiencing a very busy health service and applauding the doctors and nurses, and how could that be a fall in output? And so there's an opportunity here to speak to that audience because the demand is there. But I would also say to you, Ed, I'd love it if journalists would stop focusing so much on headline GDP and have the opportunity to talk about some of the you know, many other fantastic statistics that there are out there.
Yeah, I'm with you on that, Diane.
Indeed. I think it's going to be a brave journalist, though, who takes the first, brave economics journalist who takes the first go at ignoring GDP on a GDP day entirely, but we'll see. Maybe one more question. Kisha Bhattarai, would you like to put your point?
Very nice, fantastic discussion. I was attending this morning National Institute of Economic Research session, and the standard prediction was that by 2025, UK economy will be down by 4% compared to relative to pre-pandemic prediction. So now what you discuss here, some of the GDP is not measured yet. So I think, the all education, health, and other facilities, these might have been underestimated. That is what I got from this discussion. So is it likely to lead to a significant revision of the GDP figures of the UK economy? And so the growth rate will be, adjusted. So maybe this figure that the National Institute mentioned this morning, is it going to be lower than that what they have projected now? So this is just your opinion. So what do you think this there is underestimation of GDP? I mean, last year.
Anyone wish to take that on? Philip?
Yes, I can swing at that one. Thank you, Joe. So thank you for the question. I think I guess the first thing to say is I don't think we have a clear idea how the economy will unfold in the next few months, let alone the next 4 years. So I'm going to I'm afraid I can't offer a kind of alternative number. I think what is fair to say though is that we, particularly in the area of public services and non-market outputs, the approach that we've adopted is one where we want to try and adjust as much as possible to reflect conditions on the ground. We want our measurement to be responsive to things as they unfold and to be accurate and a fair reflection of reality. And so to the extent that we can do that in the short run, we've used the data that's available, and we've included, estimates of the contributions of things like test and trace and vaccinations, and we've included estimates for the change in education output. As time passes and as more data becomes available, both here in the UK and actually internationally, there will be a gradual improvement in understanding, a change in methods, maybe improvements in methods that move us towards a really good way of adjusting these. There are new conceptual issues here, some of which have been touched on in the course of the discussion, that we don't have good answers for yet, because some of these things have simply never happened before. The weights example that we were talking about a bit earlier is another good example. So we're doing our best that we can in the short run to make sure that GDP, as we measure it, is as accurate and as responsive as possible. Over the longer term, as more data becomes available and as we get better at this, we will improve our measurements. So it's possible there'll be revisions, and those revisions, given the period we've lived through, might be bigger than they have been previously. But our kind of guiding light here will be to try and do the best job that we can with the data that's available and the methods that are available to us right now. That's what I'd say, Joe.
Thank you very much. We're nearly out of time. I found the discussion fascinating. I think one thing which has been actually consensus about is that this is definitely a subject whose time has come. There's public interest and there is work to be done, and it is quite a long time, as Ed said, since I worked on this, and Tony Atkinson, more importantly, worked on it. I think the truth of the matter is that it was, as you say, Ed, an agenda which attracted a lot of attention right up until the financial crisis. With the financial crisis and the recession, it sort of slipped down the list and has kind of never quite re-emerged in the list of priorities for ONS or indeed other statistics offices. But perhaps now is the time to come. And it's very encouraging that with work like is going on in ONS, but also work such as Diane is talking about. It sounds to me as if we have a basis now for a really good look, re-examination of this work and relight the burners. I think probably that's the point at which we should leave it. It's now 6 o'clock, and I know people have had busy and tiring days, in most cases anyway. So if I could just thank the panelists, Ed, Diane, Philip and Paul. Also thank the people who participated and asked very pressing and important questions. And otherwise wish, I think, everyone a very pleasant evening. So thank you very much indeed. Thank you.
Thank you, Joe.
Thank you.